Hello, this is Siddharth Ambar from Chicago Arthritis and Regenerative Medicine. A common question I get asked from some patients is, what makes us different than some of the other clinics or physicians who are offering these procedures? And it reminds me, that question reminds me of something that I've heard from other patients. I've heard other patients say that their physician or their surgeon had told them that they could try a regenerative medicine treatment like platelet-rich plasma or bone marrow stem cells, but they weren't sure if it was going to help and it wouldn't hurt, and they were sort of wishy-washy about it. And it kind of reminds me that there is a difference between knowing something and being truly an expert or master at something. So some of the difference that I see when I see colleagues or the way that we do it versus maybe some places that are not quite as experienced with regenerative medicine are as follows. First and foremost, in my clinic, we are very much just dedicated to treating musculoskeletal conditions, arthritis, tendonitis with non-surgical methods. So I've seen people who offer regenerative medicine, but they're really not just focused on it. They're doing a lot of other things as well, such as they're doing Botox, they're treating erectile dysfunction, they're doing age management. They're kind of spread out everywhere. They're not really focused on the musculoskeletal system. And that's a problem because medicine is so vast, there's so much to learn and understand that if you're not really focused on something, you're not going to really be an expert at it. Number two is I've also seen people who, surgeons who are experts at surgery, that's 99% of their work, and they'll dabble in regenerative medicine. And the problem is the skill set you need to do this correctly goes beyond just being a dabbler. And dabbling in something means that you're not going to be an expert. And so I would strongly recommend working with someone who is focused on non-surgical treatment of musculoskeletal conditions and not really doing 10 other different things or not really focused on these treatments properly. The next thing that I see that's a bit of a difference is that for folks who are new to regenerative medicine, they don't really understand a concept called prolotherapy. They don't understand that the goal is to treat not only inflammation and pain, but to actually improve stability and function as well. And the way that you do that is by treating not only a joint or a tendon that's problematic, but you treat all the other soft tissue structures. So for example, if you have knee arthritis, the key is that you don't just inject cells into the joint, but that you actually inject cells into all the other soft tissue structures that drive the problem as well. And that includes the ligaments, the tendons, treat any of the nerves that may be problematic, the fascial structures that can be pathologic as well, and at times even the bone that may be stressed and swollen as well. And having that understanding that you need to be comprehensive in your treatment and not just too limited is a big difference in terms of results and how some people do a better job than maybe practitioners who are a bit less experienced and knowledgeable. Next, I think you need to have a really high and expert level skill of using image guidance for these kind of injections, and that includes using ultrasound and x-ray. I've heard some more experienced older colleagues say that they don't need ultrasound or x-ray guidance when they do their injections because they're experienced. And I can tell you, as someone who has a lot of experience himself, and in my case for regenerative medicine since 2008, that if you want to inject a cell into a structure, an area of pathology that is 1 millimeter by 1 millimeter in size, you need to inject that with imaging guidance. You can't do that blindly. You can't do that just by palpating the anatomy on the skin. That's not fair. This is different than injecting steroids. When people inject steroids are fat soluble. And what that means is that even if you don't hit the structure, there's some benefit of decreasing inflammation. When you inject your own cells, you need to be so precisely on top of the target. You can't be close to it. You have to be directly on that exact specific spot. And if you're not, you will not get the right response. And then lastly, I think really understanding the details of what are the cells that we're injecting. So I have a lot of colleagues who will use a one-size-fits-all approach to doing these kind of treatments. And that's dictated based on the kit or the centrifuge that they use. Meaning if you come in with knee arthritis, they're going to use the same platelet preparation as they would in someone who's coming in with lower back pain or someone with shoulder tendon pain or something else. And the reality is that all those need to be treated differently. You need a different platelet preparation for knee arthritis, a different platelet preparation from a rotator cuff tendonitis, and a different platelet preparation from someone who has a lower back issue. I think a big difference between a clinic or a physician that's doing this in a high level and one that's not is that the ones who don't understand this, they treat everything in the same kind of way. While a physician who is more experienced in this is treating this with nuance, where they can understand that the platelet or the bone marrow preparation that you need for a joint is different than a tendon, is different than a ligament, is different than a nerve, is different than a muscle, and is different than a bone. So without that kind of nuance, you're not going to get the right kind of response. So what's the difference between how we do things and some other clinics? It's everything.